Thank you, Dr. Kim, for joining us. And if you don't mind, I'll jump right in.
Great. Thanks, Brian. Thanks for having me.
Yeah. So I'd love to hear what you're working on right now, what you're doing in Massachusetts. How are you all managing the COVID pandemic there?
Well, if I could just, go back a little bit, I was trained in infectious disease. I did an MD and a PhD, and my PhD was in anthropology. And so, for most of the last, almost 30 years now, in many ways, Partners in Health and myself, we've been fighting against the global public health community. I'm happy to say that the global public health community has come around eventually to the positions that we've taken. But, the drug-resistant TB work was really the first experience that I had confronting directly the global public health community. And what we found in Peru, in a small community in the northern cone of Lima, Peru, we found essentially an outbreak of multi-drug resistant tuberculosis. And this is one of the hardest things to treat of any disease that you can imagine. And so we found so many cases there that we thought, we've got to treat this. And then when the World Health Organization, we found that their official position was that you don't treat this in developing countries because it's too hard. And we made the case that this is an airborne infectious disease. You can't just not treat it because it's infecting other people and it's growing. And so we fought that for 3 years. Finally, the World Health Organization changed their position. And then a few years after that, we were looking at a situation where 25 million people were living with HIV, and the vast majority were in developing countries, 20 plus million in Africa. And again, the official position of the World Health World Health Organization, yes, but the entire public health community was, you cannot treat HIV in Africa. And so we, once again, in Haiti, we showed that it could be done. We showed before and after pictures of people looking like they were skeletons. And then a few months later, we called it the Lazarus effect of HIV treatment. And I went to the World Health Organization to fight this battle. And so at a time when literally everyone was saying it's impossible to treat this in Africa, we started at the World Health Organization a movement to get millions of people on treatment. The real change, though, happened when President George W. Bush committed to treating people living with HIV in Africa. And it happened after a late night presentation of photos and slides from our experience in Haiti. So and President Bush later confirmed to me directly that that was very influential for him. So we've done this for a long time. And then for Ebola, we were 9 months into the Ebola epidemic, and I was the president of the World Bank. And I was watching, and I kept thinking, okay, something's going to happen here soon. I'm sure it's going to happen. And then I called Paul Farmer, my colleague of many, many years, and very close friend at Partners in Health. We were co-founders. And I said, Paul, what is going on there? And he said, oh, God, Jim, I have never seen so much virus. And this is so bad, because they'd already started working in Liberia and Sierra Leone. And he told me that if we don't stop this in these 3 countries, if it goes to Delhi, if it goes to Karachi, this could go on for years. So I called around, I asked around, and once again, there was a kind of, the global health community was a little bit frozen. Médecins Sans Frontières, MSF, Doctors Without Borders was screaming about this. And so I stepped up and I went to the board and I said, look, we've got to do something. And so we were the first organization to pledge any money for Ebola, and we pledged 400 million. And it was a record for the World Bank Group. We got the money moving in 9 days. Normally it takes a year, because it's a huge process of getting all of these things approved. So once again, with this pandemic, I have been watching this and I've been saying, surely we're going to respond. Surely there's going to be a huge effort on the public health side to do the right thing. And we just haven't seen it, unfortunately. And there's some very important data that's come out of China, Singapore, Korea, and now also Spain and Italy. And what it shows is that the social distancing measures that you're all obeying, I hope, right now, that involves almost 40% of the global population, those social distancing measures are extremely effective in getting the reproductive rate down. And so we talk about R0, and the reproductive rate in Wuhan, China, early on was almost 4 new cases per each case. And so the number of cases is rising really, really quickly. With very strict social distancing, that level dropped to a little bit over 1.2, maybe 1.3. And then after they instituted, and this is not something exotic, it's just the basic public health measures, which is you test as many people as you can. And you even are suspicious of people just with symptoms, even if they don't test positive. You isolate the people who are sick. You quarantine the people who you have a high suspicion that they've had very close contact with someone who's sick. And then you do that again and again and again to make sure that you stop transmission. So what we learned, and what we're learning from everywhere, is that once you put in social distancing measures, you can pretty much stop the transmission that's happening between households. But then you also have to take on the transmission happening within households. So you can't just do social distancing. You have to do social distancing, you have to do testing, contact tracing, isolation, and quarantine. And so I took this argument, and frankly, there is not a single state, certainly not a single state with a large number of cases that's doing this now in the United States. Some of the states with very small numbers of cases are doing it, and the reason they're doing it is it's the standard public health response. It's what everyone does. But something happened in the United States, and even at a time when there were so few cases, commentators came out of the woodwork saying, it's too late, there's community transmission. All you can do is mitigate, which meant social distancing. And so I kept thinking, but then the other shoe will drop, right? I mean, and that something else is going to happen, and we're going to put the whole thing in place, and it didn't happen anywhere. So I decided that the thing to do would be try to get it done in one state, and then hope that the example of that one state would lead to other states saying, what are they doing? The argument that I think is most powerful is, well, some of the modelers are saying things like, well, all we can do is wait for the development of herd immunity. In other words, when you have 70 or 80% of the people who've been exposed and have antibodies, then the population basically will be immune. But if you buy that argument and you look at the mortality already, then you're going to have extreme, and I call them grotesque, deaths in the communities that we found to be most susceptible. A lot of them are low-income communities, a lot of them minority communities, elderly people, people with other medical conditions. And I just think that would be completely unacceptable. And the hospitals, again, would be overwhelmed. And so I think from a moral and ethical point of view, you can't just let things go. The economic impact is absolutely severe. And my former deputy, who's now the head of the IMF, Kristalina Georgieva, IMF just put out a report saying, look, this is the worst economic disaster since the Depression, much worse than the global financial crisis. And so in a situation like that, what do? You've got to get the economy back up and running. You can't just let the people with pre-existing conditions die. What do? And so we made the argument to Governor Charlie Baker that you have no choice but to start right now, do much more testing, do contact tracing, and figure out a way to do isolation and containment so that you stopped all the forms of transmission. And then when you do that, that's when you can feel comfortable opening up the economy again. But the argument that I think made the most sense to governors is, oh, and by the way, if you were to have any hope of opening up your economy again, you have to have that exact same system in place. And it takes time. I mean, we're in the middle of incredibly complicated negotiations with community health centers. I mean, the fact that we don't have a single payer healthcare system makes a difference, because we're seeing people go to health centers and told that they can't get tested because they don't have the right insurance for that health center. So we're working through all that. We have to, but Massachusetts, because it started 2 weeks ago, is going to be ahead of every other state in the union in terms of being able to open up its economy. Now, of course, it doesn't make sense because the borders are porous. So we're now seeing exactly what I'd hoped. I'm getting calls now from governors of other states saying, we get this. We understand that we can't open up the economy until we get these systems in place. Can you help us do it? So that's what we're doing. And an op-ed, sort of a longer op-ed piece, should be coming out later today, describing some of that experience.
That's really interesting. I want to dig in a little bit on isolation and quarantine. Can you tell me a little bit more about how that would work?
Yeah, I think we're just in the process of trying to figure that out right now. And so, what's happened in Korea? Korea, it's quote unquote voluntary, but they watch you. And if somebody is actively sick with COVID-19, they very strongly urge you to stay in these places that they've set up, dormitories, empty hotel rooms. And the good news there is that when you go to those places, they're directly connected to the healthcare system. So there are nurses, there are physicians who are watching you while you're in isolation. The thing that's really helped is that if you may be sick enough to isolate, you may be sick enough so that you need some medical attention, but you may not be sick enough that you have to go to the hospital. That's what China did. China built these huge hospitals, 2 hospitals, a multi-thousand bed hospitals in a period of 8 or 9 days. They did that, and what they did was they put the milder cases there, and they didn't need to worry about infection control because everyone there was COVID positive. And what they were able to do is separate those people from their families and provide medical care, food, everything else in a centralized setting. Now, I don't think that'll work in the United States. We have to figure out how to do this so that it makes sense from the perspective of human rights and protection of privacy. But what we've found is that there are a lot of people who, when they get sick, they're extremely worried about infecting their family members. We were just speaking with one of the gentlemen who's running the COVID response in France, and he said that a deputy minister of health became COVID positive, isolated himself at home. Just to be clear, isolation means the separation of people who are sick. Quarantine means the separation of the people who you suspect of being positive for any virus. And so he isolated himself at home, and he infected his entire family. Right? So we're seeing, we see this everywhere. That the Koreans work very, very hard to get people who are sick out from their families, and the way they do it is they say, "Don't you want to protect your family?" And of course, most people will say yes. And also, don't you want to go into a setting where there will be food and you'll be cared for? There'll be physicians there. If you get more serious, instead of having to come to the emergency room, they will move you directly to a hospital. So we're still playing with this. We've got to figure out how to do this in the right way. Unfortunately, as this gets worse, as the economic impact gets worse, as the number of bodies continue to pile up, I think that and I hope as understanding of the importance of isolation and quarantine goes up, my great hope is that the people in the United States will be more open, never to forcible quarantine, but to cooperating and volunteering to either isolate or quarantine as necessary. In China, the specific issue was they tried home isolation, they tried home quarantine, but the houses were so small, there were so many people in them that, and especially in the lower income areas, they just couldn't do it effectively. So that's why they did what they call centralized quarantine. We'll have to figure it out, but I mean, that's just our task. A lot of empty dorm rooms right now, a lot of empty hotel rooms. We're looking at doing just that in Massachusetts.
Great. And then as I think about that, what you're describing requires a lot of trust in the government. And one, I think we're at maybe an all-time low in trust in government here in the States, at least. And that trust is not distributed evenly, right? And so when you look at the communities that are most likely to be affected negatively by this, so for example, my hometown of Chicago, approximately a third of the population is African American, but they make up 70% of the deaths thus far. Yeah. That population is likely to have very little faith or trust in the government. How do you make this work with those communities?
It's a great question, and I mean, one of the questions that comes up is, well, why is it Partners in Health? I mean, Partners in Health is known for doing work in Haiti, in Africa, in Latin America. That's where we work, and why here? And I think part of the reason is that we're actually very comfortable with using what we've called community health workers. You know, in Creole, in the Creolized French, we call them accompagnateurs, some people who accompany others. And what we found is that if you train and you pay people from the communities to be health workers in those communities, that's a very good way of building trust. Right? And also, it's a good employment program. I mean, right now, one of the things that are also extremely frustrating to me is that, you know, there was the first $2 trillion tranche. It looks like there are going to be more $2 trillion tranches. And in all of that, there was very little money for public health. So if you could imagine, what if you had a program where in the African American community in Chicago, you specifically put out a call for hiring community leaders who would become either contact tracers, who could become social support providers, and you know, a lot of that could be done electronically. I mean, all of our contact tracing now is being done electronically, but you could set up a program like that where you know, you actually give people a livelihood during this time, and people also feel like they're helping their community, helping their country. There's nothing simple about it. You know, in fact, Governor Pritzker called me the other day because he'd heard about the MASS program and is really interested in doing this. And it's one of the things, you know, his deputy governor, Sol Flores, was very sensitive to these issues in the communities. So I think it can be done. I think you have to gain the trust of people. And it's hard in some areas, but that's why you have to enlist community leaders. We've done it in some of the most difficult situations. I mean, we did contact tracing in Liberia during the middle of the Ebola outbreak with mostly illiterate community health workers. Mm-hmm. So compared to that, you know, we think that Chicago is doable.
Great. And I'm happy you brought up Liberia, so I wanted to expand and think about vulnerable populations outside of the US. So what's the role of rich nations in supporting developing nations as they also face the pandemic?
Yeah, you know, it's it's now, I mean, some of you probably didn't even know that there were 210 countries in the world. That's the number of countries that have at least one case of COVID now, 210 countries. At the World Bank, we had 189 member countries. The United Nations has 194, but there are, I think that's all the countries, the established sovereign countries in the world. And so this is actually not over. The pandemic is not over until it's over everywhere. Right? And you know, in developing countries, so a big part of our work now at Partners in Health is trying to stand up responses in developing countries. And you know, everyone's favorite, the darling of every development professional in the world is Rwanda. I mean, President Kagame is extremely good at running a country, and he has once again, not surprisingly, set up a COVID control program that looks a lot like Korea. I mean, it's probably one of the closest to Korea I've seen to date. But the other countries are going to have more problems. Now, what we're going to have to do is try to use, you know, I just spoke with a wonderful group, the Drugs for Neglected Diseases group, and they're trying to, they think that there are a lot of drug combinations using HIV antiretroviral drugs, that you could have a different strategy in developing countries where you treat earlier, you use point of care antibody and antigen tests instead of the much more expensive PCR tests, and you can come up with a strategy where you really try to get on top of any outbreak early. That's what we're trying to do in the 7 countries we're working in, and we're now working with the World Bank and the World Health Organization to try to put a strategy together. Now, the question about responsibility, I absolutely think it's a responsibility if you care about ending the pandemic. You've got to figure out how to stand up public health systems everywhere. The bank, I'm very happy to say, has pledged, I forget the number, but it's over $10 billion for health systems development and building these public health response networks. It's great. It's about time we did it. It's important to do it. You know, what's going to happen in Africa and other, well, you know, one of the things is that the differential mortality as you go up the age scale, that the older you are, the more likely you are to have problems. You know, since some of these countries have such huge youth populations, young populations, it might have a milder course. it's going to be very difficult to treat people. I mean, the most single hospitals in the United States have more ICU capacity than most countries in Africa. So it's going to be difficult. I think there is a huge responsibility. I think it's going to be hard to get those funds when every single country that's the usual donor is so engaged with trying to respond to their own epidemics.
Mm-hmm. And thinking about the trade-off in terms of the economic and the health trade-offs, how are scientists like you able to have as much influence as possible?
Well, I think that we'll see what happens. I mean, I would say that probably the most important active experiment in the world is Spain and Italy loosening up their restrictions. Now, the World Health Organization has told both of those countries that this is not the time to do it. Those countries have been very strict in terms of their lockdown procedures. They're very strict in terms of stopping transmission between families. But when they open that up again, it's very possible, because they're not down to zero anywhere close to zero. Wuhan went down to 0 new cases of transmission from within Wuhan. They waited almost 2 weeks, and then they opened up the economy. But they did it very carefully. They've got these huge armies of testers, contact tracers in place, ready to jump on anything. They've had to go backwards and forwards. They've done lockdowns in other areas when cases broke out. You look at, Singapore. They've had, a very different kind of approach. They let economic activity go on, but then once they had a cluster of guest workers become positive with COVID, what happened is they've had to lock down the city again, right? So I think that hey Brian, I forgot your original question. I was getting to it. It was about
Scientists having influence, right? So
yes.
given the pressure,
right.
economic pressures, right? And even in the U.S.,
right.
there's a huge pressure to open up. And when you listen, many of the scientists say, like, this is not the time to do it. How do we make sure that scientists have influence?
I don't know the answer to that, but the reason I went to Spain and Italy is because I think what we're going to see there is I think we're going to see outbreaks again. Mm-hmm. And maybe not. If we don't see outbreaks, it will mean something's happened that's different. That it's not, that the virus is behaving differently now, and that would be great. If the virus behaves differently, you still have to build all these systems, because you still have to be ready not only for this outbreak, but COVID could come back. COVID could mutate, come back. There could be others. We now know that, and this is what's changed forever. We now know that a single virus can bring down the entire global economy. We now know that. So you have to build those systems anyway. But if something happens and Spain and Italy are totally different, then I think the science will tell us that it's okay to loosen up and get economic activity back up and running. How this decision will be made, my own sense of it is that I think the governors will make these decisions. And to the question earlier, with some exceptions, there are a lot of governors who have very high trust figures. Charlie Baker is doing fairly well. Of course, Governor Cuomo is doing very well. My understanding is that Governor Newsom is also doing quite well, and that people like the way that he's been responding. And so I think that the governors will have a lot to say about it. If you just simply now launch into opening the economy, I just think that unless something dramatically different from everything we've seen so far happens, it's going to be another disaster. Right now, everyone's very interested in the work of the IHME, the Institute for Health Metrics and Evaluation in Seattle, Washington, and the person who runs it is Chris Murray. He was a classmate of mine during medical school and residency. Chris is one of the smartest guys I know, and what he's been saying is, it could be that the social distancing measures will work better than we expected. And it could be because the houses are bigger here, other than in New York City or again, unfortunately in poor populations. It could be that the numbers are less than they've been in other places. But he also says, if you stop shelter in place, on May 1st, you'll see another peak, maybe even larger in July. So look, the scientists are totally in agreement that you cannot do this unless you have a bunch of things in place, but we'll see what happens.
Mm-hmm. What would you, I mean, I'm going to put you on the spot here a bit. Obviously, international travel has been really curtailed. It's all slowed to almost a trickle. What do you imagine about the ability for people to move around the world, right? That we've become accustomed to, that our economy depends on to a large extent, the global economy. What are your predictions there?
Well, I think that I'm just listening to Bill Gates talking. He did an interview, I think, just yesterday, and he still says 18 months for a virus. I mean, excuse me, for a vaccine. And Bill knows more than anybody about where we are in vaccine development. So I think that, so the business I do now, I left the World Bank because I came to the conclusion that the biggest problem in emerging market infrastructure, and therefore the biggest problem in emerging market economic development, was the lack of private sector investment in infrastructure. There's just no way that the global system, with all the multilateral development banks, all the aid institutions together, have enough resources to build the kind of infrastructure we need in developing countries. And so I joined Global Infrastructure Partners to do just that. And that's what I was doing when all this started. And we actually own airports. One of our big areas of business is airports. And we're trying to look at this question right now. I don't think we're going to go back to anything near normal until there's a vaccine, or until we've built these systems that can respond quickly. And what we're looking at right now is, how do we change the nature of air travel? How do we make airports safer? It could be, though, that at some point, the kind of distance that you need inside airplanes to be safe will just make it economically, not doable. So this is going to be a big issue for a while. Which is also why I'm working so hard to get everyone to understand that you've got to invest in public health.
Mm-hmm. All right. On that note, I want one more question.
Okay.
Can you give us a silver lining? What's something positive that will come out of this?
Well, I think that this was a hard lesson, but in October of 2019. After Ebola, I along with the Director General of the World Health Organization, we commissioned a report about infectious diseases and where we are. And that report, once again, like other reports, there were reports in the late 1990s. There was another report in 2003 after SARS. Report after report after report saying, "Wake up, folks! We've got to put these public health systems together. We've got to be ready to respond quickly." And frankly, the only countries that took it seriously were the countries who had real experience. And so why was there, there was a delay in China in recognizing how serious this was, but they were ready to respond, and they had the resources to respond because of SARS in 2003. Korea was ready to respond because the MERS, the Middle Eastern Respiratory Syndrome, which is also a coronavirus, much more deadly, not as transmissible, scared the heck out of the Koreans in 2015. Mm. And so the Koreans actually enacted a different set of laws that would be put in place once a pandemic was declared, or a public health emergency was declared. And that's why they're able to use credit card information and GPS information to do their contact tracing. So if there's a silver lining, it's that we now all know that this is possible. Mm. For me, I spend more time with my kids, but I think that the economic impact is, and the folks at my firm, Global Infrastructure Partners, keep saying, "Okay, Jim, we'll let you talk, but only if you don't depress us completely." But now they're asking me to talk even more, because frankly, I've been right, unfortunately, in terms of how serious this is, and how much there's to be done before we get it under control.
Great, thanks. I want to now turn and give students a chance to ask a few questions. So just really briefly, if you were, you all should check your chat just in case Bernadette is trying to reach you, so we know you're here. But Izzy, you had a question?
Yes, thank you so much for being here, Dr. Kim. I think you touched on this in many ways already. In the past, you've described the role of partners in health as pushing the boundaries of what people thought was possible. And I was just wondering how you think about this now during the COVID epidemic, and also maybe kind of going forward as we're coming out of this global crisis.
Yeah, so I know you guys also study leadership and the fact that that we're in working through the behavioral institute. I forgot the exact name for it, but what I found once again is that we had to come in and we had to be the ones who said, no, contact tracing is not impossible. No, figuring out a way to keep families safe is not impossible. And we had to keep saying it, based on the fact that we'd done it in much more difficult settings, right? And so I think in every job I've ever had, in some way, my role has been to say, no, it's not time to quit. No, we've got to do this, and better just to get started than to keep arguing about whether it's doable or not, right? So we still do this. I mean, it's still my role. We do phone calls. So just to tell you how complicated this is, we do phone calls every morning at 7:45 for 45 minutes, and then every afternoon at 4 for another 45 minutes. I have another phone call at 8 p.m. where I'm working with the state to procure PPE, the protective gear, from China, and we have to do it at 8 p.m. because that's when they wake up in China. I have my own colleagues from Global Infrastructure Partners are helping them manage the supply chain over there. So it's all day, every day, and even in those roles, even in those phone calls, in all of them, my role is still to say, no, don't quit, no, don't give up, let's keep going. And the thing that struck me, and you guys are MBA students, if I'm correct, right? Business people are always trying to go past anything anyone's ever done before. They're always trying to just go the mile. And my own company, Global Infrastructure Partners, it started from nothing, and in 12 years, is one of the most successful and largest infrastructure investors in the world. These guys are killers, man. They don't take no for an answer. And it just kills me that in public health, we have given up so easily so many times. Right? There's some great examples of when we haven't given up. Smallpox eradication is one. The great vaccination movement of the late 70s and 80s was another great example. But for drug-resistant tuberculosis, for HIV, we've gotten scared, and we've also gotten scared about asking for the big money. I'm in my op-ed, I'm basically arguing that the Treasury just needs, U.S. Treasury and all treasuries just need to open up their doors and put as much money into the public health response as needed, and that I hope will change the mindset of the people in public health. But I'm just seeing so much negativity and doomsdayism and we can't do it and can't do it. One of the messages I'm sending to the folks I used to work with all the time that run the big banks is, don't settle for answers from the public health people about what they think is possible. Ask them what is absolutely necessary and force us to do it. And so that's where I hope we're going.
Great, thanks. And I think our next question is from Julia.
Hi, thanks for talking with us today. I think we touched on this a little bit with Dean Lowery's question, but mine was, what more could the US government and its partners like the World Bank do to support at-risk communities during COVID?
Yeah, I think one of the emerging stories, certainly in the United States, the data that Brian just gave us about the number of people dying in Chicago, that should be an absolute wake-up call for everybody. And I know.
answered or anyone else wants to chime in, I'd be interested to hear.
Ms. Walker.
I think there's an issue with that's with audio. We'll take care of it.
Okay, all right. So I think that's a really important issue, and so you know, in Korea, in China, in Taiwan, Hong Kong, and Singapore, they had teams of people delivering food, providing direct support for for poorer people who were at risk, or I mean, who had to be quarantined. You know, in China, they forbade any traffic on the streets, including walking traffic. So they had to have armies of people delivering food to everybody, right? And so what we've been arguing is that we've got to especially focus on these vulnerable communities in the United States. And we've got to make sure that they have food, that they have medicine, they have everything that they need. And oh, and by the way, you can pay people to do that, people who are out of work. So, you know, in the first, I think, 3 days when we announced our contact tracing program, we had more than 10,000 applicants. People are, I think on the one hand, they feel great about participating in the solution, but they also need jobs. So, this is, I think, a good way for the U.S. To be able to align their fiscal stimulus with efforts that will actually help stop the pandemic. You know, it's said once in a while, but almost like a throwaway statement. This is not a financial crisis fundamentally. It's a public health crisis that's leading to a financial crisis. And so it seems so simple to say, so therefore focus on the public health crisis, make sure you get that taken care of, and then the rebound, whatever way you think it's going to rebound, then that can happen. So yes, protecting vulnerable communities has to be a huge priority. I worry very much, though, about how much that will happen in the poorest countries. I mean, you know, the India situation was just tragic. You know, people having to walk home, hundreds, maybe thousands of miles trying to get home because all the train travel was stopped. I don't know what's happening right now in that. I haven't kept up with it for the last few days, but you know, India is not the poorest country that the World Bank and World Health Organization deals with. I really worry in thinking about what's going to happen in those places without the usual kind of support that would come from the developed countries.
Okay. I have another question for you. What advice would you give our MBA students about how to respond? I think what to do in their communities, what they can do after this is over, like how should they best engage?
Yeah, well, I think it's really important. The first thing is just engage and learn about, you know, what, you know, you can even look on Wikipedia now. They have entries on what happened in Korea, what happened in Taiwan, what happened in Hong Kong, with lots and lots of references. You know, understand just as an informed citizen of whatever country you happen to be in now, of what the best response is. You need to know that. You also need to know that in thinking about what industry you go into later. I think there's some industries that are going to be fundamentally changed. You know, the restaurant industry is devastated, and it remains devastated in Korea, in China, in places that have their epidemics relatively under control. You know, think about what are the kinds of industries that are going to become even more important going forward. Telecom seems like one. I think, you know, you guys are in Silicon Valley. I think, you know, software and apps, et cetera, that help us manage, you know, when lockdowns happen, you know, could be important going forward. I think that the change that's happening with COVID-19 is much more fundamental than most people understand. You know, travel will never be the same. Eating in restaurants will never be the same. And knowing as I do people in Korea and China, you know, after those outbreaks happened, life was never the same. Life was never the same, and they were so much more ready to do the things that the government told them once they had this experience with SARS and MERS. That's going to be true for everybody.
And we have another student question, Carolyn.
Thank you very much for coming. I was intrigued by your references to a lot of the countries and what we can learn from them, but countered with the fact that countries are dealing with this very much sort of on a domestic level and of closed borders. So curious from your vantage point, what extent you feel like countries should have an obligation to collect and share their COVID-19 related data with other countries? And if there is that sense of obligation, what infrastructure, both formal and informal, needs to be in place to facilitate accurate and timely dissemination of the information?
Yeah, that's a great question. And it's actually enshrined in laws. So, I mean, to the extent that the United Nations can have laws. So there's something called the IHR, the International Health Regulations. And when I was at WHO, one of my jobs also was to help with the reform of the IHR, because the IHR, you know, the SARS in China at that time was really hidden. I mean, they didn't let people from WHO in for a long time. And so we changed it, and the new law states that in the context of an epidemic, or I forget the exact language, but in cases like COVID or in cases like SARS, the World Health Organization has the right to go into those countries without permission, examine what's going on, collect data, and report it to the world. And right now, the rule still is that all countries have to share their data with the World Health Organization. And of course, I mean, I feel so badly for them after some announcements coming out recently. I feel so badly for them because they're doing a very good job. I think they're doing a good job in the context of an extremely difficult political environment, right? And so they're trying their best. I talked with the guy who was running the response, is a guy named Mike Ryan. Mike was a good friend of mine since 2003 when I started at the World Health Organization with the Director General then. And Mike has the best perspective on this of anyone. There are others, Bruce Aylward, who ran the polio program. He's the only one anywhere in the world who's visited all the countries that have serious outbreaks. That means China, Spain, Italy. He's now going to Germany. He's visited all the most important countries. And so I think that they have a lot of really, really good data. But as you can see, reporting on any of it for them is really hard and political. Right? So the rules are in place. I think countries do have a responsibility to share their data. And because the United Nations is, in so many ways voluntary, it's very hard for the WHO to step up and really enforce things.
Okay, thanks. Jacob, you had a question?
Yes, thank you. One of the things you mentioned is that the most likely things will not return to normal until there has been a vaccine which has been developed. And so I was wondering, what are your recommendations to either private pharmaceutical companies who will join together or perhaps collaborate, or the role of governments in helping accelerate the process of discovering the vaccine, producing, and then distributing the vaccine?
Yeah, when I say that, one of the things that I'm trying to do with my communication and my the article that's going to come out soon is to say, whatever can help us stop this, the government should put huge amounts of funding in. I mean, and I'm talking about hundreds of billions of dollars. I think Bill Gates has a really good plan. I think what Bill Gates said was, what you should do is when you have vaccine candidates that look okay, start manufacturing those right away, because each one of those vaccines has to have a different process of making them. And so you just assume that if you have 6 really good vaccine candidates, you should invest in the infrastructure to make all 6 of those. And then over time, we'll figure out which one is really the best one. And then we'll take that and blow that up and make that, try to get 7 billion doses out of that. But we should do that now. I mean, that's essentially how the research-based pharmaceutical industry does their work anyway. They have multiple teams working on the blockbuster drugs. That's what he's suggesting. I think he's right. And I think that's going to require lots of investment from governments. But again, let's say, what if they put, and in public health terms, what I said about people having such low aspirations, they would never think of asking for 20 billion or 30 or 50 or 100 billion to put this structure in place. But compared to what? Compared to 2 trillion now, 2 trillion later, that's nothing, right? So I think that the government should provide financing. I think government should get out of the way, because the private sector is going to do this. I think in terms of just the rapidity of developing products, the rapidity of going going down blind alleys, of doing all that, I think private sector is a lot better at that. For testing, the actual cost of testing is about $50 a test for PCR. Quest is charging $300 per test, and the government should be ready to pay something like that, right? Because if the government says, I will pay for every test and up to $250 or $275 per test, you're going to see a lot of people flocking there. Let's use market mechanisms. Let's use market mechanisms to their full extent. We need them here. So absolutely, we need to focus on it. Pharmaceutical companies, I think if they can come up with new drugs or repurposing old drugs that are effective, that would be great. WHO is working on testing some of those varieties. The folks I talked with this morning are planning to do it on a much larger scale. I think it's very much worthwhile getting out some of the old molecules and seeing if they're effective. This could be huge, and this has to be something that's supported on an ongoing basis, because we never know when the next virus is going to come at us.
I just wanted to give a final thank you to Dr. Kim for joining us today. We really appreciate your time and all of your efforts right now with what's going on. So thank you so much.
Thank you. It was great talking to all of you. I just want to say you guys are so lucky to be at Stanford. I think is it all MBAs, or is it a variety of students?
These are all MBAs.
So if I could stop the world and do something for 2 years, I would do a Stanford MBA. I went from being a physician and an anthropologist working in global health, and then when I went to the bank, of course, I became a finance person, and I was embarrassed at the fact that I had been living for so long and never bothered to really find out how important finance is in making the world move. And so the fact that you guys are learning such critical skills about how to make something work, leadership, organizational behavior, all this stuff, I think you're extremely lucky. And I can't tell you how many medical students I've recommended to go off and get an MBA, and lots of them have done it. So we need you out there. I hope some of you work on things like putting the public health response together. And the thing that I hope you take away from this is that you guys have to be the ones who say, don't tell me it's not possible. Right? Because the public health folks, the academics, they're just they're so used to thinking in terms of scarcity. And I hope that what you're learning at Stanford is that in the business school is that the successful people are the ones who never accepted these preset limitations. So please do that. And I hope to see you out there in the world someday. Maybe some of you will be working on emerging market infrastructure. If so, come and see me.